I'm NOURI NEUVILLE. I'm resident in Paris. It's about a young 19 years old man who was referred to the orthopedic surgery. He had a 6 months history of an increasing and persistent pains in the right groin. There was no trauma and no past medical history. On physical examination, there are no fever and neither tenderness in the right groin or no limitation of motion. We have the pelvic X-ray. So, you see.
Giant sarcoma. ABC from the Boston, giant sarcoma.
So we can see a solitary lucent bone lesion. It's located in the right acetabulum, measuring approximately 4 centimeters over. It's an osteolytic, well-defined, with a thin margin of sclerosis around. It seems to have a calcification, maybe a suggestion of chondroid matrix, but we are not sure of this incident. There is maybe no infection into soft tissue, and on the Lovick classification, it's maybe 1A because of thin margin sclerosis. So the investigation, we did MRI because to know the size and to assess extension. It's better to delineating extent of narrow and soft tissue involvement, and CT scan because it's optimal for detection of matrix mineralization to confirm the presence of chondroid matrix and to explore the cortex. So coronal steer T2 weighted imaging. So T1. Gadoaxial T1. So on the MRI, the lesion was seen as a well-defined lobulated mass, measuring 7 cm in his bigger diameters. There was no invasion into soft tissue. On the T2 weighted imaging, it showed a high signal intensity of the mass with a septation in low signal. And on T1, the signal was mainly low, but we can see some component of height intensity, which are probably related to blood closures. With GADO, we can see a knock pattern of enhancements of the mass, with an endosteal scalloping and no enhancement of soft tissue. So we have CT scan. So we can see small punctured calcification and arc-ring calcification too, and it's typical of chondroid matrix. And we can also see an endosteal scalloping inside the expansive lesion. So the CT scan confirms the presence of chondroid matrix, and the MRI shows us typical lobulated mass and a typical pattern of cartilaginous bone tumor. So chondrosarcoma radiological diagnostic was made, and many small pussy tissues were taken and revealed a well-differentiated chondrosarcoma on histological examination.